Did you know that if you're over 60 and you've stopped masturbating, your body might be quietly breaking down in ways you don't even realize? No, this isn't some taboo topic or locker room chatter. This is straight up science tied to your health, from your prostate to your brain, heart, sleep, immune system, and even how you feel about yourself. I'm Dr. John Smith, a urologist and men's health specialist with over 30 years of experience helping seniors across the country stay vibrant, sharp, and strong in their later years. Throughout my career, I've seen the silent damage that happens when people neglect their sexual health, and it's one of the biggest hidden threats out there. Today, I'm going to walk you through 7 serious consequences of stopping masturbation in old age, from how it affects your prostate to how it dims your sense of self. More importantly, I'll share simple science-backed ways to take back your health and confidence. Stick with me until the end, because the 7th consequence is something even your doctor might not mention, but it could completely change how you live your golden years. If you're serious about staying healthy, sharp, and independent as you age, hit that subscribe button and turn on the bell so you don't miss advice made just for you. If this message hits home, drop a 1 in the comments. If you're skeptical, type 0. Your feedback helps me create content that truly supports you. Let's dive in with the first consequence, one that's often overlooked but can quietly disrupt your daily life. Let's start with how stopping masturbation can harm your prostate health and urinary function. I'll never forget meeting George, a 71-year-old retired truck driver, still active and full of life. He sat across from me looking confused and said, "Doc, I'm up 5 or 6 times a night just to pee. It's like my bladder never empties. I figured it's just old age." But what George didn't know, and what most folks don't realize, is that regular ejaculation, even through masturbation, plays a huge role in keeping your prostate healthy. Your prostate isn't just some idle gland. It's a living, working organ that produces fluid and needs regular activity. Masturbation helps it contract, flushing out fluid and preventing buildup. But when you stop completely, that fluid sits there, creating a perfect environment for inflammation, swelling, and pressure on your bladder. You might feel a heavy bladder, a weak stream, or a nagging fullness that won't go away. These aren't just annoyances, they're warning signs. Left unchecked, this can lead to benign prostatic hyperplasia, or BPH, which affects nearly half of men over 60. It can cause urinary retention, bladder infections, or even the need for a catheter. I've seen strong, proud men like George start worrying about leaving the house because they don't trust their bladder. They plan every trip around bathroom access. Long drives, family gatherings, or even a simple walk become sources of anxiety. It's not just physical, it chips away at your freedom. Here's the kicker. A study from Boston University found that men who ejaculate around 20 times a month have a 25% lower risk of prostate cancer compared to those who don't. Let me be clear, this isn't about chasing youth or indulgence. It's about function, about using your body's natural biology to protect itself in the simplest way possible. You can start by masturbating regularly, just once or twice a week, no overkill needed. Pair it with drinking plenty of water and avoiding long periods of sitting to ease pressure on your prostate. George gave it a try, and a few months later, he told me, "Doc, I'm not racing to the bathroom at night anymore. I feel free again." You don't have to live with sleepless nights or bladder worries. Your body just needs a little attention to stay strong. If this resonates, drop a 1 in the comments to let me know you're with me. Now let's move to the next consequence, because what happens to your brain when you neglect this part of yourself is even more surprising. The second consequence is cognitive fog and a loss of mental sharpness, something that can make you feel like you're losing yourself. I remember Henry, a 69-year-old retired accountant, proud of his sharp mind. He came to my office, eyes full of worry, and said, "Doc, I keep forgetting my friends' names or why I walked into a room. I'm scared it's dementia. Is this just what getting old is?" That question hit me hard because I hear it so often from seniors who think a fading mind is inevitable. But here's the truth, it's not just age. Part of it could be tied to stopping masturbation. Sounds surprising, but let me break it down. When you masturbate, your brain releases a mix of chemicals, dopamine, serotonin, oxytocin, that don't just feel good. They strengthen neural connections, boost memory, improve focus, and lower cortisol, the stress hormone that can damage brain cells over time. Masturbation also helps maintain testosterone, which isn't just about libido, but also about confidence and clarity. When you stop entirely, those natural brain-boosting surges fade. Your mind starts to feel sluggish, like it's running low on fuel. You might struggle to focus, forget small details like names or dates, and even start doubting your mental sharpness. This doesn't happen overnight. It creeps in slowly. First, you forget a friend's name. Then you lose your train of thought mid-conversation. Eventually, you might fear your mind is slipping away. I've seen patients spiral into anxiety or depression thinking they're losing their edge when really their brain is craving stimulation. Early studies suggest seniors who stay sexually active, even through masturbation, have a lower risk of cognitive decline. Henry, for instance, hadn't masturbated in years, thinking it wasn't necessary anymore. It showed he stopped going to his beloved chess club because he couldn't focus. The good news: you don't need pricey drugs or complex therapies. Start reconnecting with your body through regular masturbation once or twice a week, focusing on sensation, not just results. Pair it with brain exercises like crossword puzzles or reading. Henry tried this, and a few weeks later he said, "Doc, my mind feels like it's coming back. I even won a chess game last week. Your brain isn't gone, it just needs a wake-up call." If this makes you think, drop a 1 in the comments to let me know you're still with me. Now let's explore the next consequence, because when your emotions start to fade, the impact is even deeper and harder to talk about. The third consequence is an increased risk of depression and emotional numbness, something that can quietly drain the color from your life. I'll never forget William, a 72-year-old retired engineer and widower who used to pride himself on his strength and optimism. He came to my office, his voice heavy, and said, "Doc, my life feels like it's lost its color. I don't feel sad or happy, just empty." He paused and added, "Is that normal for my age?" That question stuck with me because I hear versions of it all the time. What many assume is just getting old is often tied to something rarely discussed: the loss of intimacy, even with yourself. Masturbation isn't just physical, it's an emotional release, like a natural stress valve for your body. When you reach orgasm, your brain releases oxytocin and endorphins, chemicals that ease anxiety, reduce tension, and lift your mood. These are critical in your later years, especially if you're dealing with loneliness, loss, or life's pressures. But when you stop masturbating, maybe because you've lost a partner, think it's not age appropriate, or feel ashamed, you cut off one of the body's best ways to stay emotionally balanced. Week after week, month after month, you might become quieter, more withdrawn. You skip hobbies you once loved, like William, who stopped going to his book club. You talk less with your kids or grandkids, and life starts to feel gray. The cruel irony is, most people don't see the connection. They blame themselves or think this is just how life goes in old age. But depression in seniors often hides as fatigue, irritability, or a lack of motivation, not always sadness. I've seen vibrant people pull back, not because of illness, but because they're missing that simple physical connection. The good news: you don't need heavy meds or complex therapy. Regular masturbation just once or twice a week, done with mindfulness, can help you feel alive again. Pair it with reaching out to friends or journaling to clear your mind. William gave it a try, and months later he told me, "Doc, I feel like I'm living again. I'm back at my book club and laughing more with my grandkids." It's not just about lifting your mood, it's about reminding yourself you're still human, not just a body passing time. Masturbation at this age isn't about lust or shame. It's about keeping your emotional system healthy, giving your body a reason to feel, to connect, to be present. If this hits home, drop a 1 in the comments to let me know you're with me. Now let's look at the next consequence, because what happens to your sleep when you skip this intimacy is even more surprising. The fourth consequence is poorer sleep quality, something that affects not just your body, but your energy and spirit. I remember Edward, a 67-year-old retired carpenter, who came to me looking exhausted. "Doc," he said, "I fall asleep fine, but I wake up at 3 a.m., like I've been jolted awake. Then I just lie there staring at the ceiling waiting for morning." He was pale, frustrated, and thought this was just part of getting old. When I gently asked about his intimate life, he looked away and mumbled, "That part of me is done, Doc." But that part he thought was over might have been the key to the restful sleep his body was craving. Sleep isn't just about closing your eyes. It's a complex hormonal process, and one of the most powerful natural triggers for deep sleep is something many seniors overlook: orgasm. When you masturbate and climax, your body releases oxytocin, prolactin, and endorphins, a perfect mix that shifts your nervous system from stress to relaxation. At the same time, cortisol, the hormone that keeps you wired and awake, drops sharply. Your breathing slows, your heart rate steadies, your muscles relax, setting the stage for deep restorative sleep. But when you stop masturbating entirely for weeks, months, or even years, you lose that natural tool. Instead, you get restlessness, tossing and turning. Some turn to sleeping pills. Others just accept exhaustion as their new normal. Poor sleep doesn't just leave you tired, it weakens your immune system, speeds up cognitive decline, raises your risk of heart disease, and makes you more prone to anxiety and depression. In seniors, it also increases the chance of falls, memory issues, and losing independence. I've seen active people like Edward pull back from life, skipping friend gatherings because they are too drained to go out. The alarming part, many don't realize they're missing a simple solution, not a drug or supplement, but their body's built-in release. Masturbation might seem small, but it can be the difference between 4 hours of broken sleep and 7 hours of deep healing rest. Edward, after our talk, started again gently before bed. He said, "Doc, I'm sleeping like I did 30 years ago. I didn't know how much I needed that release." Too many folks mistake this biological need for aging and suffer quietly. If you're lying awake at night, mind racing, body tense, ask yourself, when was the last time your body truly let go? Sometimes the answer isn't a pill or a breathing app. It's rediscovering a rhythm your body still knows. Try gentle masturbation once or twice a week, paired with an early bedtime. If this makes you think, drop a 1 in the comments to let me know you're still here. Now let's move to the next consequence, because what happens to your body's strength and movement is even more eye-opening. The fifth consequence is weakened pelvic floor muscles and blood circulation, something that can change how you move, feel, and carry yourself. I remember Thomas, a 73-year-old retired farmer, a man who'd always been proud of his physical strength. He came to me, voice tinged with embarrassment, and said, "Doc, I get this ache in my hips when I stand too long, and sometimes a little urine leaks when I cough or laugh. Is my body just falling apart?" What Thomas was experiencing wasn't just aging, it was a slow weakening of a part of his body most people don't think about until it fails the pelvic floor. These muscles at the base of your core support your bladder, bowels, and sexual organs. Most folks don't notice them until something goes wrong: leaking urine, constipation, erectile dysfunction, or pain when standing or walking. But here's what many don't know: regular masturbation plays a big role in keeping those muscles strong. During arousal and orgasm, your pelvic floor contracts rhythmically, like a workout, not for show, but for function. It boosts blood flow to your lower body, keeps tissues elastic, and ensures nerves stay active. When you stop masturbating, those muscles don't just rest, they start to atrophy. Blood flow slows, tissues stiffen, and nerve responses fade. Over time, you might notice frequent urges to pee, a little dribbling after using the bathroom, or aches in your lower back or pelvis. For men, this can mean a sharp drop in erectile function. For women, it can lead to dryness or discomfort that discourages intimacy. I've seen independent people like Thomas avoid social outings fearing an unexpected leak. They start using pads, planning life around bathrooms, or skipping activities altogether, losing confidence. Data shows pelvic floor weakness is linked to 40% of incontinence cases in men over 60. Ignoring this area isn't just inconvenient, it can lead to falls, loss of dignity, and dependence no one deserves. The heartbreaking part. Many think this is just getting old and suffer in silence. But your body, even at 70 or 80, still wants to work. You can change this by masturbating regularly, just once or twice a week, focusing on gentle contractions of the muscles you'd use to stop peeing. That's a simple Kegel exercise. Pair it with standing and moving more to ease pelvic pressure. Thomas tried this, and months later he said, "Doc, I'm not worried about long walks anymore. My body feels stronger." You're not just rebuilding strength, you're reclaiming confidence and independence. If this resonates, drop a 1 in the comments to let me know you're with me. Now let's look at the next consequence, because what happens to your immune system might surprise you even more. The sixth consequence is a weakened immune system, which can leave you more vulnerable to illness and slower to recover. I remember Margaret, a 71-year-old retired teacher, always full of energy during her career. She came to me one winter looking drained. "Doc," she said, "I've had 3 colds this year, and each one knocks me out for weeks. I used to bounce back in a day or 2. We checked her diet, sleep, and meds. Nothing stood out. But when I gently asked about her intimate life, She gave an awkward smile and shook her head. I stopped that years ago, she said. At my age, I thought it didn't matter anymore. But that part she thought was over might have been why her body wasn't fighting off illness like it used to. This isn't some vague idea, it's biology. When you masturbate, especially when you reach orgasm, your body produces a surge of chemicals, not just dopamine and oxytocin for feeling good, but immune-boosting agents like immunoglobulin A or IgA. This antibody helps shield you from viruses and bacteria, especially in your lungs and gut. Endorphins also kick in, reducing inflammation and aiding healing. Now imagine going without that boost, not for a week, but for months or years. Your immune system, already slowing with age, loses one of its easiest natural defenses. It's like pulling the batteries out of your home's alarm system you don't notice until trouble hits, and your body doesn't respond as strongly. I've seen patients who've stopped masturbation get sick, more often recover slower, or deal with chronic inflammation flare-ups. Margaret didn't connect her frequent colds to her intimate life. But when we talked, I explained that masturbation isn't just about sensation, it's an action that sends strength to every cell in your body. A weak immune system raises your risk of chronic conditions from arthritis to heart issues. When you stop, stress creeps up, sleep suffers, inflammation rises, and your body becomes a frailer version of itself. Margaret started again not for desire, but for wellness, pairing it with a healthier diet. Months later, she came back with brighter eyes and said, "Doc, I feel like my body's working with me again, not against me. That's not magic, it's your body responding to the signals it needs. Your immune system doesn't care about shame or stigma, it responds to action." Regular masturbation just once or twice a week, done mindfully, can boost your natural defenses. If this makes you think, drop a 1 in the comments to let me know you're still here. Now let's dive into the final consequence, because it cuts deeper than anything else, your very sense of self. The 7th consequence is the deepest and maybe the most heartbreaking, losing your sense of ownership over your body and your self-worth. I'll never forget a quiet conversation with Charles, a 76-year-old retired banker who used to carry himself with confidence and sharpness like he could command a room. But when he came in for a routine checkup, something had changed. His shoulders were slumped, his eyes dimmer. As we talked, he sighed and said, "Doc, I don't feel like I really live in this body anymore. I'm just existing in it." That hit me hard because I've heard versions of it from so many seniors, each with different words. But the same truth, somewhere along the way, they stopped feeling at home in their own skin. It often starts with silence, with letting go of intimacy with yourself, thinking it's no longer needed, too late, or something you've outgrown. But here's what happens when you stop touching your body, when you stop paying attention to it in that personal, private way. You begin to disconnect slowly, quietly, sometimes permanently. Masturbation isn't just about pleasure, it's about presence. When you engage with your body, even gently with no goal, but to feel, you remind your nervous system you're still here. You still matter. Your body is still part of who you are, not just something you're waiting to leave behind. Without that, a gap forms. You start ignoring small aches, avoiding mirrors, believing this chapter of life isn't worth nurturing. That's the deepest loss, your sense of worth. I've seen this disconnection lead to emotional numbness, shame about aging, pulling away from touch, even neglecting basic self-care. Charles admitted he'd stopped caring about his appearance, quit exercising, even stopped eating well. "Why bother," he said, "when this body doesn't feel like mine anymore?" That word "anymore" broke my heart, because that's what happens to so many seniors who lose touch with their physical selves. They don't just lose pleasure, they lose identity, presence, a sense of being alive. But here's what I need you to hear, it doesn't have to be this way. Reconnecting with your body through masturbation isn't about chasing youth, it's about honoring the life still in you. It's about saying, "I'm still here, I still feel, I still deserve to be seen even by myself." You can change this, and it starts with your permission. Try gentle masturbation once or twice a week, focusing on presence, not performance. Pair it with journaling or meditation to nurture your inner connection. Charles did this, and months later he told me, "Doc, I'm looking in the mirror and seeing myself again, not a stranger." When you reconnect, even in the privacy of your home, you start erasing that sense of disappearing. You remind yourself aging isn't vanishing, your worth doesn't expire with youth. That's maybe the most healing act of all. If this speaks to you, drop a 1 in the comments to let me know you're still with me. Now let's tie it all together because this is about more than health. It's about reclaiming your life. If you've made it this far, I want to talk to you not just as a doctor, but as someone who respects the journey you're on. Looking back over my 30 years caring for seniors, what moves me most isn't the medical challenges. It's the quiet losses people carry, losses that don't show up in lab tests or scans. A man who once stood tall now avoids mirrors. A woman who radiated joy says she hasn't felt her body in years. Too often they're told this is just what aging looks like. But I don't buy that, not for a second. And if you're still here, I don't think you do either. The truth is, when you stop caring for your intimate self, when you let go of that part of your body and identity, a chain of quiet consequences begins. We've walked through them, how skipping regular ejaculation can inflame your prostate, disrupting your bladder and stealing your freedom. How it clouds your mind, making focus and memory harder. How it invites depression, draining the joy from hobbies you love. How it breaks your sleep, raising risks for heart disease and falls. How it weakens your pelvic floor, leading to leaks and lost confidence. How it dims your immune system, leaving you vulnerable to illness. And most painfully, how it makes you feel like a stranger in your own skin, eroding your sense of worth. These aren't small things. They're not just aging. They're signals your body, mind, and spirit are crying out for attention. I've sat with patients who felt broken, disconnected, numb. But I've also seen their eyes light up when they reclaim this part of themselves. It doesn't take a partner, youth, or perfect health, just your permission to see yourself as worthy of intimacy now more than ever. I know this topic makes some folks uneasy. Some feel embarrassed. Others were never taught it's okay to care about their sexual health past a certain age. But hear this from a doctor who's walked this path with thousands. It's not just okay, it's essential. Masturbation in your later years isn't indulgence. It's about circulation clarity, hormonal balance, emotional grounding, immune strength, and identity. It's not a luxury, it's a statement that you're still alive in this body and responsible for its well-being. One patient, a 74-year-old man, told me I didn't realize how much I missed being myself until I touched that part of me again. That's what this is about, not just surviving your years, but living them with presence, dignity, and joy. So if you've forgotten this part of yourself, buried it, or judged it, I invite you to rethink it. Reconnect. Start small with curiosity, with kindness, but most importantly, start. Because when you choose to care for this part of you, you're not just protecting your health, you're reclaiming your life. Don't keep this to yourself. Hit like, share this video with someone who needs it, and drop a comment below with your thoughts. Whether you agree, disagree, or have questions, your voice matters and your story might help someone else feel seen. Type 1 if this resonates, or 0 if you've got something to share with me. Thank you for being here, and let's keep exploring ways to keep you strong, sharp, and vibrant